So when a patient comes to see me, they usually have reached out with a phone call to my lovely secretary Tracy. Shout out to Tracy. Or they'll make contact, or they might be seeing their GP. You may have seen your GP, and you may have known people that have seen their GP and have potentially explored this option. And then they come and see me with a GP referral. So a general practitioner will certainly advise you in a very open, honest way if this is something that potentially should be explored. And I do see GPs and give talks to them to educate them about who this could be indicated for. A person may have been struggling with their weight for many years, and the reality is most people that come and see me, this has been a chronic problem. So if you're considering if weight loss surgery is appropriate for you, then it's not just a binge over Christmas period, for example. It's usually been a long-term struggle. And you wouldn't be alone in that respect. We know that the overweight condition and obesity is extremely common now, and it's a burden for an individual, absolutely, and also our society as a whole. 2/3 of people either are overweight or are in the obese category, and 1/3 of Australians, and probably even more so now on updated statistics, are in the obese category. That term may not always be used, but that you'll still see the term obesity used in terms of the surgery, the weight loss surgery. It does follow a lot of guidelines that I operate by and ensure that I follow to ensure that it is only offered to people who it should be offered to, really. So as mentioned, it's usually when someone's been struggling for years, and the story is often that they may have struggled from their adolescence sometimes. People talk about the school days. Another common time people mention, obviously women, is following a pregnancy, maybe their first or second pregnancy.